right. Hi, everyone. This is Dr. Moore again with ND Direct Docs. I am here today with Dr. DJ Trigg of Kids ENT of Indiana. So he's a pediatric ear, nose, throat specialist up on the north side of Indianapolis. So we are going to talk a little bit today about nose sprays. I have a lot of personal experience with them, lifelong Midwestern allergy sufferer, and I was just telling DJ Trigg here about the fact that I lied to my doctor for years and said I took it. I didn't, because it burned, it tasted bad, it was gross, and it didn't help when I took it for 2 days. Shocker. And it wasn't until like a decade later that I got miserable enough that I finally looked up how to take it properly and realized, oh, it's actually pretty easy. And oh my goodness, it works well when I take it the way I'm supposed to. And I generally try to educate my patients on how to use them right. And my main advice is you don't have to do what I say. That's fine. I'm telling you what I know. And when you're miserable enough, you'll probably be willing to try it. So just let me know. But I'd love to hear what advice you give patients on how to use a nasal spray.
Right. So, so when I was in training, we didn't get that information, but there was a study that came out about 8-10 years ago, and it looked at all nasal sprays, and it basically boiled it down to 3 things that make nasal sprays very effective. So one of the very important things to keep in mind is that your nose actually occupies the middle third of your face. So when you're using a nasal spray, you actually kind of want to aim almost horizontal, not quite, and you want to aim towards the back of your head, because you want to spray this way. Even though the opening is point downward, you don't want to point this way. You actually want to head back. So you want to aim towards the back of your head. When you spray in, and this is probably the single best piece of advice, don't sniff in robustly, because, and most people do that. They do the spray and they're, no, you don't want to do that, because if you do that,
I did that.
Yeah,
Big
there you
mistake. Big mistake.
Most of the spray is going to go down the back of your throat, which means A, the medication or the saline or whatever is not staying in your nose. And number 2, it tastes bad. So in kids, your compliance is just going to go right out the window. So if you're not sniffing in, it's going to be more effective and it's going to be tolerated better. I did have a patient one time who mistook what I said, and they came back 2 months later and they said, well, we haven't been breathing through our nose for 2 months. And I'm like, well, what do you mean? I said, no, you just weren't supposed to breathe in when you did the spray. And they're like, oh, like, no. Anyway.
Miscommunications always happen, yes. And you see mostly kids, but I will tell you, compliance is even worse in grown-ups, because no one's gonna hold them down and make them do it.
Right. The third piece of advice was you actually wanna aim sort of towards your eyeball.
Yes.
That most of the operative structures inside your nose are on the sides, not in the center. And the center is your septum. And so it's just kind of a wall that goes straight back. And when you're doing this, in fact, what the recommendation was to take the spray and use the opposite hand to spray the opposite nostril, because that will almost naturally aim it in that direction. So your right hand sprays your left nostril. And so it's going to aim kind of in that direction. Left hand sprays the right nostril. And that will automatically aim it in the right direction, because what we tend to do is we tend to use our dominant hand, and so on that side, hitting the septum, and it's just flowing right back, and it's not doing any good. Plus, you can wear down that portion of your septum. So those are the 3 basic pieces of advice that make nasal spray so effective. And it doesn't matter what the nasal spray is. Again, saline, nasal steroid, or a decongestant. The final part that I say for parents is that, because compliance, again, is challenging, is with saline spray, which is just salt water. Kids do it. Even if they're 2 years old, if they're spraying the dog, who cares? And they're, the air, their eyeball, it's just saline. It's no big deal. But it's gonna give them more control, and so they're gonna be much more likely to let you spray the nasal steroid or whatever you have to do to make it more effective.
Yeah, that's actually a really good tip. I have not tried that one before, but I'll have to start. But yeah, I will say, when I finally learned the whole aiming it this way and not sniffing in large, just like a little, at the most, just a little teeny sniff. Yeah. And then my other one I have to sometimes tell people a lot is, it's more about after you take it, which is don't lay down for an hour or 2, because then it's going to, if it is kind of still moving, it does drain back. Right? I'm like, not right before bed,
Yeah, you've got all these microscopic hair cells, which are actually going to, some people say, well, what if it drips out? Like, listen, that's okay. You got all these hair cells that are actually going to move it in the back. And
Right.
so just let nature do its thing, and it'll actually spread it around appropriately. So yeah, that's a
I
good
like
piece of
that.
advice.
Yeah, I've been surprised. I mean, as a patient and then now as a doctor, I've been surprised pleasantly at how much more effective it is
No.
and how much more pleasant. Like, honestly, I usually tell patients to give it like a week or two of practice because you have to kind of play with the angle until it's perfect for you. But after I got good at it, like by the second month or sooner, honestly, 99% of the time, I've been using my nasal spray now for a decade. I have to have it. I don't even realize I'm taking it, except for the occasional time when one of my kids pops in right as I'm about to use it and I'm distracted and I miss aim. It's
It's
really,
not it's not as effective in your ear when you.
no, it's not. It's just not. Well, thank you so much for taking the time to educate
No
us.
problem.
That's a really common topic in primary care. I'm sure you see it a lot also, but it's surprising to me how many people don't get any education on it from their doctor or their
Yeah.
pharmacist. Although I say that now in the direct primary care space where I have a lot of times to talk with my patients and I can explain it. When you're dealing with 10 or 15-minute visits and handling a lot of things, or the pharmacist, kind of the same situation at the big box stores. It's not easy to educate people on what you need to know, but man, if I write a prescription
But
for a
it's
nasal
important.
spray and I don't educate on this, I may as well not have written it, I find, because nobody will take it and I don't blame them. They're gross if you don't know how. So, all right, well, we'll talk to you next time. Thanks so
All
much.
right. Thanks. Take care.